help of modern medical techniques, open heart surgery takes far less of a physical toll on the patient than it used to. Tonight, hear about two different heart valve procedures that produce the same life-saving results.
Tom Cross had his mitral valve repaired just over 2 months ago. And Ernest Hine just had his aortic valve replaced. Both men had heart valve disease. Both needed open heart surgery.
I was shocked. I broke it to my family. They were shocked. Having an annual checkup one day and then getting referred to a cardiologist who did an echocardiogram and him saying that, yeah, you need open heart surgery, preferably before the end of the year, is an eye-opening type of thing to hear.
I did notice that I would run out of breath when I was making the beds or I bent over tying my shoelaces. I was short of breath.
Two Valley cardiac surgeons, Dr. Richard Gregory and Dr. Peter Birnbaum, say this should be taken seriously.
It's important because we know with valve disease, there's no pill that's going to take away the valve disease.
If your heart is suffering because your valve's not working, any valve in your heart's under stress. And if left unattended over years and years, that heart will eventually get tired and quit.
Heart valves act like doors, and as they open and close, they keep blood flowing through your heart the right way. There are several things that can cause valvular problems, but once discovered, treatment varies.
Mild, where somebody should have their heart valve disease monitored with routine follow-up, routine echo, routine checkups with their family doctor, or it can evolve to being quite serious, requiring heart surgery.
If you have shortness of breath, chest pain, dizziness, swelling of your feet, or you're unable to sleep flat in bed, these could be signs of heart valve disease.
My breathing was a little bit more difficult and labored before the surgery compared to now.
Yeah, I'd have died from it. They got me just in time, he says.
Heart valve surgery is an open heart procedure, and surgeons can either repair or replace a valve. Ernest Hine was born with an abnormal aortic valve, which is very common and in most cases calls for a valve replacement.
Most commonly, what we see in the aortic position is instead of having 3 leaflets, they have 2 leaflets. And that just doesn't work quite as well, and the blood has a harder time going through that valve.
Once the decision to replace a valve is made, patients have 2 options.
The 2 types of valve that we use for aortic replacement, one is a mechanical valve. It is a bileaflet valve, and it looks and feels like metal, although it's actually not. The nice thing about that valve is that valve will last forever.
One disadvantage is the patient must take blood thinners for the rest of their life to prevent blood clots. The other option is a tissue valve made from, most commonly, a pig valve.
The nice thing about that valve is that it's natural, and so after a period of time you don't have to be on a blood thinner the rest of your life. The disadvantage of the tissue valve is because it is tissue, it will wear out someday, and that's usually nowadays 20 or years so after the surgery.
Advances today make open heart surgery easier for the patient.
I would say that in Fresno we're probably doing, at least I'm doing, 70% of our aortic valves through what we call a mini incision. It's about a 2-inch, maybe 3-inch incision over the anterior chest or the front of the chest here. And we can see everything we need to see and go ahead and either repair or replace the aortic valve in that way.
Ernest and Dr. Gregory chose a tissue valve, and it was the right decision for him.
Good, very good. Yeah, my wind is back, and I have no problem whatsoever.
Here we go.
Tom Cross wanted to make sure he was there for his young family. He had trouble with his mitral valve.
We'll open the left atrium, and this will give us excellent access to the mitral valve.
In many cases like Tom's, the mitral valve can be repaired rather than replaced.
So here the patient will be able to retain their own valve. They don't need an artificial valve, but the valve has been repaired by the surgeon to restore normal function.
I wasn't sure that they could repair it until they got in, but once I heard that they repaired it after surgery, I was very happy.
The stroke rate, the risk of infection, the risk of bleeding from anticoagulation, all those risks are less in patients that have undergone valve repair versus those that have undergone valve replacement.
Tom says he's grateful he now has time for the important things in life, his family, and has this advice for others.
If you start getting feeling fatigued and you can't quite do the things that you used to do a couple of years ago, it's important to go to the doctors and have a checkup.
And the two great-granddaughters.
As Ernest and his wife look back on 59 years together, they look forward to more.
Oh, they want me around for a little while. Probably another 10 years. Maybe.
Oh, I'm sure 10 years is just the beginning. If you have concerns about your own heart health, visit your doctor. Many times they can detect heart valve trouble simply by listening with a stethoscope or by using x-rays and an echocardiogram. For more information on this story, just go to our website. It's medwatchtoday.com.